Hello. Today we will be speaking about antibiotic treatment for 7 versus 14 days in patients with bloodstream infections. So we will be speaking about antibiotic treatment for 7 versus 14 days in patients with bloodstream infections. In this trial, this will be a randomized trial. And in here, we will be treating an infection that can either be caused by bacteria, a virus, or even fungi. So the way this happens is the presence of active and living fungal or any bacterial microorganisms within the bloodstream is basically called a bloodstream infection. And the best way to treat a bloodstream infection is an antibiotic. Antibiotic is one of the best treatments to treat any infections, and it is very well known to treat infections. And within this trial, the treatment is conducted for 17 to 14 days within this trial. So some introduction and background on the trial. So it is abbreviated as BSI, known as bloodstream infection. This infection disease could even have an can have an inflammatory response and can also cause deaths. And within this randomized trial, it has caused many and several deaths, not even several, a lot of deaths. And this randomized trial is going to determine the duration of antibiotic treatments from 7 to 14 days. To treat bloodstream infection, antibiotic was used to check how effective it is and how it is already known as safe. And we wanted to go ahead and test the effectiveness of it. And also, positivity of one or more blood cultures is also known as a bloodstream infection. So, bloodstream infections are very common and fatal, and among more than 600,000 cases all around have been noticed. So within North America, there has been 90,000 cases which have led to death per year. Every year, there are about 90,000 cases that lead to death, and per year worldwide, there are about 2.9 million deaths per year. So, the best way to go about it and treat it is an early antibiotic therapy. The faster you know, the better, and it's best if this infection can be detected early on. The earlier an infection is detected, the earlier antibiotic therapy can go about, and the survival rates can be a larger amount or a higher percentage. So, some study design and methods. So this is a phase 3 trial. As it's randomized, it's also controlled, uh, open label and non-inferiority, meaning not more worse than. Within the data of this randomized controlled trial, the data collection sample size is 3,600 patients. There will be a total of 3,608 patients enrolled within this trial. The median age of the participants included will be 70 years. And also 53% male and 43% female. And also it is 74 hospitals across 7 countries. So the random assignment of hospitalized patients, including ICU patients, there will also be ICU patients who will be receiving antibiotic treatment within this trial. And the treating team will decide the dosage and the route of antibiotics. And the included patients or the patients that can be included must be patients that have a bloodstream infection, because we want to go ahead and see the effectiveness of this medication, of this antibiotic, and see how effective it is. And the only way to be able to go ahead and see how effective it is to make sure that the inclusion criteria is only patients that are diagnosed with bloodstream infection. For exclusion criteria, patients that have severe immunosuppression, also long-term treatment for foci. So these are patients that we are not going to include, and this is the exclusion criteria. These patients will not be included. So right here we have presented some results. At enrollment, there is ICU patients with a percentage of 55%. The hospital ward patients there were 45%, and to the right you see deaths within 90 days from any cause. This can be due to any cause that deaths have occurred. As we see in the 7-day group, there were about 14.5%, and in the 14-day group, there was 16.1%. So, also in this graph on the right, you see that the urinary tract infection there is about 42. As it shows 42 for the abdomen, it's 19, lung 13, vascular catheters is 6, skin or soft tissue being 5. So within 90 days, with respect to death, the antibiotic treatment for 7 days was non-inferior to 14 days treatment, meaning not worse. So the 7-day treatment was more effective in comparison to the 14-day treatment. So the bloodstream infection is lethal and to treat an infection. An antibiotic treatment was introduced for this trial to see how effective it is in either 7 days or 14 days. So as the trial lasted from 7 days to 14 days, it was a 7-day intervention group versus a 14-day intervention group. So the primary outcome measured was all-cause mortality within 90 days following the diagnosis of bloodstream infection. So for sure, it was seen that the 7-day antibiotic treatment was way more effective in comparison to the 14-day intervention group. So in this trial, results indicated by 90 days, there was 261 patients. 14.5% died taking antibiotics for 7 days, while 286 patients, which is about 16.1%, died taking antibiotics for 14 days. So the percentage was a bit higher for the patients that are taking antibiotics for 14 days. So, antibiotic therapy improves bloodstream infection, and it is way more effective if a infection is detected early on. The antibiotic therapy is a lot more effective, and it can improve or even save from death rates. Also, early antibiotic treatment for bloodstream infections is an essential also, but however, it can be very unsure of how long treatment can take, but it did show and appear that 7-day treatment was more effective in comparison to the 14-day treatment, as this 14-day treatment caused more deaths in comparison to the 7-day treatment for the patients. With reference to patients, syndrome, and pathogen qualities, the results of trial were consistent. Also, 7-day antibiotic treatment can be used with patients with bloodstream infection, but you want to make sure that you do not want to exceed the 7-day duration. Also, further researches can be conducted to see, if it is necessary that 7 days is best, or maybe, an 8-day trial is needed or a 6-day trial is needed. But within this intervention, it did show and appear that the 7-day intervention was way more effective than the 14-day intervention. Um, again, so some of the limitations in this trial was definitely lack of the placebo control. Um, Also, 23% patients received antibiotics for longer than 7 days. So, also the findings do not apply to other pathogens or syndromes. And within 90 days, respect to death for patients that were admitted into the hospital with bloodstream infection, the 7-day antibiotic intervention was definitely had better results in comparison to the 14-day treatment. Thank you. Hello, and I just wanted to mention one last thing, that these are my mentioned references for the clinical trial. Thank you, everybody.